like to request Dr. Amit Gupta to highlight overview of refractive surgical procedures.
I'm a refractive surgeon and proudly so. And I work for the government, so there is no financial interest here. And I would like to thank Dr. Harpreet and Vision 2020 for giving me this opportunity to be a part of this very interesting and meaningful session. So if we look at refractive surgery, it's any eye surgery that's used to improve the refractive state of the eye or to decrease the dependence on glasses in patients. Now, if we look at the eye, the cornea and the lens are the two major refractive things in the eye, and that is why the refractive surgery can be either cornea based or lens based. We have been through these statistics, and we look at myopia, and it's estimated that by 2050, more than 50% of the population may have some kind of a refractive error. And almost 10% would have a high myopia, which is actually a pathology. It's such a disease for patients to have. Now, what options can we offer for refractive vision correction to the adult population today? And I just couldn't resist putting this slide that as far back as 1896, man has always wanted to play with refractive errors, try to take them away and try to improve them. And the history goes back almost 125 years or more. But it was actually in about 1987 that the first PRK was performed, and in 1995 that it received FDA approval. In 1999, the LASIK got the FDA approval, and in 2016 the SMILE got the FDA approval. Now, when we talk about lasers, there's a tendency to have what is excimer laser, what is femtosecond laser. So I just put in a couple of slides. Like when we talk about photoablation, what happens is there's a laser mechanism by which the molecular bonds are broken using high energy UV photons. And what happens is that due to that there's a promotion to repulsive states between the molecules of the cornea. There's dissociation, there's an ejection of fragments without causing a necrosis, which goes in the form of a plume, and then therefore it leads to practically the disappearance of tissue and flattening of the cornea. On the other hand, the femtosecond laser works by photo disruption. So there's a little laser spot, and that generates a plasma, and it just expands to form something known as a cavitation bubble, and that is how the bubbles join together to create an interface. And if we have a little overview of what we can do with the eye to get rid of refractive errors, they have been majorly classified into something which causes incision of the cornea, surface ablation, or laser-based or microkeratin-based incisional procedures, or lens-based procedures. So this is the reason why radial keratotomy and astigmatic keratotomy is no longer popular, because it used to cut up the cornea and create so many other problems in patients' lives. If we look at the procedure of the surface ablation, the basic principle is that the surface of the epithelium is removed from the cornea, and then it is followed by excimer laser photoablation, and this causes a change in the corneal shape, and we can get rid of the refractive error. Slides are not moving. Okay. All right. So the in thing right now is what is known as SMILE, which is the small incisional lenticular extraction. So what it entails is just removing a stromal lenticule from the eye, and thereby changing the corneal shape and causing the removal of the refractive error. I'm sorry, I apologize, some of the videos are not working. Yeah, and in case of people with high myopia, which is more than -10, -15, -20 diopters, there is something known as an phakic intraocular lens, which is injected into the eye, and thereby it gives good vision to these patients without actually causing a change in the cornea. which would actually lead to so much induction of higher order aberrations in these patients. Other techniques which are very selectively practiced are putting in some kind of rings, especially for diseases like keratoconus. It can really improve the quality of life in these people. Also other inlays, stromal and other inlays which are used to correct some of the refractive errors. And with the excimer laser platforms, it is possible for us to actually take care or try to not induce so many higher order aberrations, thereby leading to a much more superior quality of vision. Also something known as topo-guided ablation. These are all platforms which we can use with the excimer lasers. But we should not forget that these refractive surgeries have a lot of complications, and it is only with meticulous protocols coming into force that my personal experience and is that the incidence of complications has now gone down, but it does exist, and this is something which has to be communicated to the patient when the patient comes to us wanting refractive surgery. I was trying to find literature which would compare, I'll just wind up in 1 minute, compare different types of the outcomes of different types of refractive surgeries. So I did come up across a network meta-analysis. Now, if the volume of cases is shown by the size of the dots, and unfortunately this is a few years old. I think we can look forward to another such publication coming in, but out of a very complicated kind of analysis, including the surface under the cumulative ranking curve and comparison of predictability and safety of these procedures, this study has concluded that actually, including the contrast sensitivity in this patient, that there is no statistically significant difference in either the visual outcomes or the visual quality amongst all these surgical procedures. They all appear to be working pretty well with people. Also, many of these patients might have some visual symptoms which are important. Glare, daytime glare, or dry eye, or nighttime clarity of vision, gritty